Sometimes today I see people running down the street and I still get a sense of longing for being able to do that, which is silly. So I walk a lot, but it's just different.
Hi, my name is Steve Clisby, and I'm hosting The Gout Show, a new podcast that's all about dealing with gout, a medical condition that is pretty much misunderstood. I know this firsthand because I was recently diagnosed with gout, and I've been surprised by how much I've needed to learn in order to manage it better. Now, I'm 74 years old, and I'm in pretty good shape. In fact, it was my personal trainer who suggested that I might have gout when I came in to work out one day. And my foot was so swollen and painful that I couldn't walk. It was bad. And in fact, I ultimately needed to go to the hospital, and it was there that they told me that I had gout. And I've been on a mission to educate myself about it ever since. Over the course of this podcast, I'll be sharing stories of fellow gout patients who've lived with this condition a lot longer than I have, as well as getting information from leading doctors who treat gout. Now, I learned a lot about how mysterious gout symptoms can be, about who's really at risk of getting it, and about the best ways to treat it, since it's a condition that I'll have to live with for the rest of my life. Now, in this episode, we'll hear from Ashley Newton, who was diagnosed with gout a few years ago after she started having some pain from running. What you'll hear today are real stories from real people that have had real experiences with gout. But remember, everyone's health is unique. No two stories are the same. If you or someone else you love has gout, go to www.thegoutshow.com, where you can get help for your situation.
Hi, I'm Ashley Newton. I'm 36 years old. I live in Nashville, Tennessee. I'm married to my husband, and we have 2 kids who are 11 and 14. So I was diagnosed with gout in February of 2016. I had noticed pain in my knee that got worse when I was running, but very quickly it got to a point where the pain didn't happen only while I ran. I noticed the pain while I was sitting or, doing chores at home, and seemingly overnight, it got to where I could not bend my knee or my ankle. I went into the orthopedic surgeon for what I thought was a really simple running injury with a simple treatment. And instead, they diagnosed me with gout and other, chronic conditions. And they really snowballed. So I felt like they were able to identify one chronic condition, and before I knew it, there were several that all required treatment. I was 32 years old at the time, and I was an active runner, and I was in reasonably good health. It was so uncommon for me to hear about younger women being diagnosed with gout. Most of what I hear about gout, I hear about pain in the big toe. And so I was surprised actually to hear that I did have gout, because I wasn't experiencing pain in my big toe at all at that point.
When I was first diagnosed with gout, I was in a bit of a denial, and although I do know gout is more common in men with older age, and I didn't think I had some of the known risk factors like being overweight. Now, take someone like Ashley. She's young, she's female, she's healthy. I don't think of someone like Ashley as getting gout, so I turned to a doctor who specializes in gout to find out more. We'll be hearing a lot from Dr. Fields throughout this show.
My name is Dr. Ted Fields. I have a long interest in treating patients with gout and in research about gout. I'm a rheumatologist at the Hospital for Special Surgery in Manhattan, and I'm a professor of clinical medicine at the Weill Cornell Medical College. Gout is a condition where people have too much uric acid. Uric acid is actually a waste product in the body. It's what happens when the body breaks down proteins. The disease of gout is when those crystals start to cause trouble. And most commonly what they do is they build up within the joint, and then as they get released into the joint fluid, the white cells of the body attack them, cause inflammation, and it's what somebody would experience as a hot, red, swollen, painful joint because of the inflammation of gout. The cyclical nature of gout is something that's very definitive about how gout presents. It tends to cycle. You get a flare, you're normal, and then you flare again, and the flares are intense. That's very characteristic of gout. When gout starts, it's most commonly in one joint, most commonly the big toe, but could be the ankle or the middle of the foot or the knee. But classically, it'll start in one joint. Over time, if it's not treated, if the uric acid never gets lowered, then what happens is that the next flare might be 2 joints. And people with gout for many years that's not adequately treated may end up having 3 or 4 joints flare up at one time. The cause of gout is essentially always genetic. They have a genetic tendency to either make too much uric acid or not be able to get enough uric acid out in the urine.
Next up is a message from our sponsor, but stay with us because after the break, we'll be coming back to hear from Dr. Fields about some of the risk factors of gout.
The Gout Show is sponsored by Horizon Therapeutics. Horizon is focused on researching, developing, and commercializing medicines that address critical needs for people impacted by rare and rheumatic diseases. Have you ever had a sudden pain and wondered what it could be? Nearly 9 million Americans have gout, which means you or someone you know has gout. Visit thegoutshow.com to learn more and to take our quick quiz to find out if you've got uncontrolled gout, as well as find resources on gout and other related diseases. Visit thegoutshow.com.
So welcome back to The Gout Show. I'm your host, Steve, and I'm learning so much about managing my own gout symptoms, hearing the journeys of my fellow patients. Now, let's see what Dr. Fields has to say about some of the risk factors of gout.
There is no typical patient for gout in the sense that you can get gout having none of the usual things that we think about. I have many patients who eat all the right things, their weight is normal, they're not taking any medicines that raise the uric acid level. It's important that when someone gets something that looks like gout, they get checked, even if they're a woman, even if they're a young man. People can get gout at almost any age and any sex, so that people should get checked.
I'm glad I got diagnosed with gout when I did. At first, I assumed that my pain was just a touch of arthritis or maybe from working out too much, but then the pain in my foot got so bad I couldn't ignore it anymore. Gout has started to slow me down a bit with my workouts and exercise, and the same thing happened to Ashley. Here's more about how gout has affected her ability to be active.
The ways that I exercise now are very different than they used to be. I used to be a distance runner, and I had done that for several years prior to being diagnosed with gout or rheumatoid arthritis. And both of those diagnoses have changed that for me quite dramatically. So 2 months prior to being diagnosed with gout and rheumatoid arthritis, I had run a full marathon and, was planning for another one and was training for kind of the marathon. It's the country music marathon. Being from Nashville, that was a really big deal to get to participate in that. And unfortunately, I've still not been able to. And losing that was just really challenging. Today, I enjoy walking, and I walk every single day, even if all I can do is 15 minutes. But I am up to walking several miles again, which, has been really exciting for me. And I've had to work hard to be able to do that. I also enjoy bar classes, and that does help me to build strength. It really is that combination of both the medication and the exercise. I think doing those two things, but really consistently, even on the days that I don't believe I need to take my gout medication because I'm not experiencing a flare-up, I take it anyway. And that has made just a tremendous difference.
Wow, it's like really reassuring to hear someone like Ashley has found a way to stay active, even if she can't run like she used to. She's also shared some other advice and keeping track of all her symptoms, and I found that really useful.
Another big lesson learned for me, I talk about this frequently, but I was diagnosed with a couple of different conditions at the same time, and I really struggled to understand which symptoms came from what condition. So which symptoms that I was experiencing really were because of gout versus rheumatoid arthritis. And so writing those down for me became a really powerful tool. I use an app on my phone called Arthritis Power, and about once a month I'll take a gout measure, and then I take that with me to my doctor's appointment so we can look at it together and understand how well the medication and the dietary changes in my exercise routine really are helping me to manage my symptoms from day to day.
Runners are usually used to tracking their own progress via apps to check how often they're running, what speeds, what lengths. By tracking progress, you can see if you're generally doing better or getting worse. It's great there's an app like Arthritis Power that can help people with gout be a part of improving medicine and care for everyone. just by having more informed conversations with their healthcare professionals. So we've got this show and a whole lot of other helpful information at www.thegoutshow.com just waiting for you. Try to say that a few times. www.thegoutshow.com. So I've had some mild gout pain since having that one bad attack about a year ago, but it's a little nerve-wracking knowing another flare-up could happen at any time. I'm still working with my doctor to figure out exactly what treatment plan is good for me. Now, Dr. Fields offers his perspective on getting gout in check.
I've seen a number of people over the years who will come in with very severe flares. Their whole foot will be swollen. They'll be having to give up things that they like doing. Their flares were so frequent, they had to give up their running. Their quality of life was clearly decreased. They were missing time from work. But then when I see them, let's say a year later, after we've been modifying their medication and they've been taking it, they'll come in and they're perfectly fine. They're not limited in any activities. They're not having painful flares. And certainly when you see people at 2 years, the vast majority have stopped having flares completely and their quality of life is dramatically increased. So gout is clearly a condition where the quality of life can be dramatically improved.
I think the thing I'm most excited about is being able to share in every episode the advice from the patients about what they would want someone else to know who was newly diagnosed with gout, to know that it's possible to live with it and you can still be doing well. Now, here's Ashley's take.
For someone newly diagnosed with gout, there are a couple of things that I would share with them. The first would be just to not feel overwhelmed. My advice would be to seek the information about your condition so that you can understand it, but don't put the pressure on yourself to understand it all the first time you read it. It's okay to read it once and come back to it in a couple of days. And every time you do that, you start to remember new things about your condition, what it is, what it means to live with it, and how to manage it moving forward. The other lesson, I guess I would share is that gout behaves differently than I expected it would. When you're diagnosed with gout, you hear a lot about it, and sometimes the symptoms that you experience don't always match. So my suggestion would be to write them down and talk to your doctor about them. You know, it may be that they are connected to your gout condition, or it may be something else. But either way, I think your doctor can help you to understand whether you need to make a change to your medication, regimen, or to other lifestyle choices that might help you to better manage those symptoms. Gout has changed my life in a number of different ways, some good and some bad. Obviously, having a flare-up disrupts my day-to-day life so that I can start to feel better and function again fully as myself. I know more about the condition. I have a better understanding of how it impacts others outside of just myself. It's made me more empathetic toward others who are also suffering from gout or other similar types of conditions.
Thank you to Ashley and Dr. Fields for sharing their perspective. It's clear that even though we think of some certain quote-unquote facts associated with gout, like that it mainly causes pain in the big toe or that it mainly affects older men, there's a lot more to it than that. And these misconceptions can get in the way of people like me and you getting the right diagnosis and care. And that's what this Gout Show is all about. So stick with me as I keep learning more and more about gout and see what's coming up in the next episodes.
Couldn't get around. I couldn't do the things I wanted to do. And I felt I had to go to the doctor to get to the bottom of it, because after it happened a couple of times, I knew it wasn't an injury anymore. And I went to the doctor, and they diagnosed high uric acid and gout at 18 years old.
So thanks for listening to The Gout Show, and don't forget to subscribe and give us a rating. We look forward to sharing more with you in the next episode.